Well, good afternoon, everybody. I'm Don Clavin, the Town of Hempstead Supervisor, and I'm joined, of course, by my colleague in government, Councilman Anthony D'Esposito. Anthony?
How are you? Good afternoon, everybody.
And, of course, ahead of our EMS right here in the town of Hempstead, Dr. Dave, as he's referred to. Doctor, as always, it's great to have you here.
Good to see you, Supervisor.
Good to see everybody. And I hope all of you that are watching at home are safe and are comfortable for our Facebook Live interaction, where we'll be trying to field a number of questions. Before we begin, I do want to go over a couple of important announcements. As many of you may know, back in March, I joined with the Receiver of Taxes, Jeannie Driscoll, and all the board members asking the governor to extend the second half tax payment. That has now been extended. That has been extended until June 1st to pay your second half school taxes without penalty. Go to the town website if you'd like more details on that, as well as the 3 additional drive-through locations the receiver and I have put in place at various locations throughout the town that will be available, so as you can simply drive up to one of these windows, make your tax payment there, and get your receipt. That will be in addition to the drive-through locations at 200 North Franklin. Those are implemented with conversations with our head doctor here in the town to address social distancing and as a safe protocol. In addition to that, I'm happy to announce that everybody that we will be going back to our full recycling and sanitary schedule pickup starting on Monday, May 4th. Again, thank you for all of your understanding the necessity due to staffing and making sure for the safety of all the men and women that are our essential workforce down in the sanitary district and working with us. I know some of us are very passionate about our recycling, and I know that many of you are, and we heard it. But now through the advice of our treating physician as well as the Commissioner of Sanitation, we think we are back to not having any scheduling problems due to the pandemic. So the schedule will be back in full force starting Monday, May 4th, right back to your regular cycle of sanitation and recycling. With that, maybe we can also start off with a little bit of a little insight, a little update of what Dr. Dave has been seeing taking place out there at our hospitals, and could share with all of us.
Yeah, sure, Supervisor. Hi, everybody. So, good news. We've been talking a lot about the curve and the number of patients and how people have been doing. You know, we can't let up on what we've been doing with social distancing and, wearing masks now. We don't have ours on, so we can talk to you, but we all have them with us, so we can put them on when we're done. It does appear right now that the folk coming into hospitals that we're seeing a lessening of that volume, which is really good news. That does indicate that the curve is indeed flattening and starting to now come back down on the other side. We still need to continue doing what we're doing because we do not want it to go back up again. We've heard me reference this before, 1918, our last pandemic that we dealt with. The second peak after the first one was actually the worst one, and we don't want to repeat that. And that happened because after everyone did the right thing and everything was looking better, they loosened up on the restrictions, and then the virus spread again. So, the virus is not going to give up. So we don't need to give up, and we can't give up until we have the chance to get this defeated once and for all. But the good news is that hospitalizations are new hospitalizations are going down. It appears that new cases are going down. It appears that for right now we're getting a hold of the situation. So I do like to bring that good news to you guys that what we're doing is working. Continue to be the great civilian responders that you are, and doing what you need to do to prevent the spread, and we'll continue from there.
Okay.
If you guys want to.
Councilman?
Just wanted to really thank everyone in town government, our great workforce, for, kind of getting used to the new normal. I think when we started this whole process over a month ago, we were really unsure of how long this was going to be, and I think that we've all reached agreement and kind of become comfortable with the fact that this is the new normal for a while. And I think that what Dr. Dave mentioned is critically important. We can't let our guard down. We can't forget that we need to follow protocol, continue that social distancing, because it does matter. And just as, although we are seeing improvements, we can quickly get back to a really disastrous area.
Yeah, we don't want to lose that.
And it's it's not just the work of our town folk, but all those in the hospitals and nurses and doctors, our first responders, everyone has just done such a great job, and to see all that work bring us a step backwards would be terrible. So I think we really need to make sure that we can continue the steps in the right direction. And I just wanted to say thank you to the supervisor. I know that over the last 6 or 7 of our Facebook Lives, there's been thousands of people that have joined us, have watched with us, have communicated with us, asked questions, and I know that one of those big questions is always about recycling, and it is important. People really do feel strongly about it, and I think it's great that although we're not back to 100% being our normal selves, we are making the steps necessary in order to continue providing the services that we provide here in the town of Hempstead, and I think that that's what's really been our mission from day one. Day one, we weren't sure how long this was going to go. We weren't sure, how much of our workforce we were going to have to, be without, how long we were going to have our buildings closed for. But we've kind of come to the new norm, and I think that the fact that we're making steps to bring us back to where we were over a month ago is important. So great job by both of you.
Oh, and just quick, guys, along with what the councilman was saying, I know a lot of people were scared to go to the hospitals and to go to doctor's offices when the coronavirus was at its peak and you were seeing all these people getting sick. But it's important that we take care of all of the issues that people have, not just coronavirus issues. So understand that the hospitals and the urgent cares, we're very good at this. In a very short period of time, all of us have figured out how to do this in a way that we can keep the people without coronavirus safe and take care of the people with coronavirus. So if you have other medical issues that are bothering you that you've been ignoring, we don't want that now to become a problem for people. So it's very important that if any kind of medical issue that you have, if you feel that you need to go to a hospital, do not be afraid you're going to get coronavirus from a hospital. Our hospitals know what they're doing. They know how to keep everyone separate, so we're not making it spread any further. They've made a lot of the hospital areas at my hospital at NYU Winthrop negative pressure, which basically means the virus gets sucked out of the air, so the air is clean. I am positive that other hospitals have done the same, and even the urgent cares now are getting very good at letting people come in and get taken care of. So I just want to put that out there as kind of a public service announcement before we move on. Just if you have another medical problem, do not be afraid to seek medical attention. Call your doctor's office. Go to an urgent care, or don't be afraid to go to the hospital for something other than coronavirus, because we can take care of it. You're not going to get sick there from it, and we got to make sure we're addressing all those kind of medical problems, so that way everyone stays healthy for all the reasons they might be sick.
Great. I saw one question out there. A resident had a problem with a piece of property in Uniondale. I do want to remind you that if you call the main number at 489-5000 and report that piece of property, we will have crews available to go out and take a look at it. I appreciate that. And I again, one of the big issues, and we're working with the doctor very diligently, is how reopening will be done based on the guidelines that are being set forth by the governor and the state. But it's really, a lot of this is based on the advice of our health professional and the steps that are going to be necessary. And I'd love to tell everybody out there that, with the snap of fingers, everything is going to open up and be wide open and it's going to be back to normal. Obviously, I think we all realize it's not. But when we get the information, we'll provide it. Just like I said, we've made the recommendation based on our health professional and our commissioner that we are at the staffing levels and the safety levels for our sanitation, for any latecomers. So recycling, full service goes back, again, May 4th. And I know, and people are very passionate about it, so spread the word. We're going to be sending that out there. But when it comes to, the golf courses, Merrick is open. We're in the process of opening, let me phrase it, Lido is open. We're in the process of setting forth to reopen Merrick. Again, with protocols about how payments were received, the social distancing that needs to be taken into a place there, and what could be utilized. And we're doing that in all of our parks. And again, it is by not only sitting down with myself, the board members, our commissioners, but with the advice of our health professional, who has just been great about it. Doc, and I'll go to it every single time, masks. One of the things I think, again, is explain the necessity, and again, show people, again, maybe they haven't seen it, how you properly put on a mask. Because that's one thing I've seen when I've gone out to a number of stores, people grabbing them from the inside, throwing them on. Again, I just think it's worthwhile for you to give that demonstration so people understand it. And maybe you could pass it on to your family members, as well as your children, who obviously, don't maybe understand these things as well, and need assistance putting on the mask.
Sure. So just in case you guys haven't seen any of our previous Facebook live sessions, the purpose of the masks is that you're trying to decrease the droplets, the small little amounts of saliva that come out of your mouth. Because that's the primary spread, the primary way to spread coronavirus. So the reason we do the social distancing and we're staying 6 feet apart is because if those cough droplets, if you cough or you sneeze or you talk loudly, those droplets can leave your mouth and typically won't go further than a few feet. That 6 feet radius gives you a pretty good protection. But there's also this thing that we've talked about previously called a super spreading incident, where people, if you have a lot of people in one place, all of these tiny little particles and droplets that come out of our mouths can kind of congregate together and then cause it to spread faster. That's why we're trying to decrease large crowds, why we're trying to keep people spaced apart, and now why the masks are such an important adjunct. A lot of people in the first few days that they're sick may not realize that they're sick. They may think it's allergies, or they may have such mild symptoms that it's asymptomatic and they don't notice that they're sick. And this specific virus, 20 years ago, the original SARS virus, the virus very similar to this one, we got a lot of healthcare workers sick because it was about a week and a half into the disease when it was the most infectious. This one, the one that we're dealing with now, COVID-19 or SARS-CoV-2, this version of the coronavirus is the most infectious in the first few days that somebody is sick. And especially in that first day or two when they are spreading the virus, they may not notice because, again, they're not feeling sick. So that's why the masks are so important. I'm going to show you how to put a mask on here. Because wearing that mask allows your cough droplets to get caught in the mask itself. I'm going to show you the mask first, and I'm going to put a clean one on so you see. So this is just a general piece of cloth. Councilman's got a nice, looks like a superhero mask, and the supervisor has just one of the surgical masks. So these are all of these are reasonable masks. Again, we've talked about this. The fancy N95, KN95 masks, those are meant for the healthcare workers because we are very close to the people that are sick. These just general cloth masks, or the surgical masks that look like that, they can block between 50 to 90% of the particles. So depending on how well you fit that mask, it actually does a really good job. It's not going to be good in a hospital, but in a normal, everyday sense, it's going to be good for you. So let's show you how to put the mask on. Just real quick, I'm not going to put this one on because clearly my hands have been all over it, but I just want you to see there's basically two sides to the mask, of any mask. Mine's black, so it's a little hard to see, but there's going to be an inside and the outside. To the councilman, you'll see the inside is obviously the side without the print on it, and then the outside's that. So you want to keep the inside, and the same with the supervisor, you want to keep the inside of that mask clean, because that's the part that touches your face. I have basically just a bunch of these cloth ones that I acquired, and I just use them, and then I'm then just disposing it. Putting them down so I could wash them, because it's hard for me to tell the inside and the outside, and I don't want to take a dirty mask and put it on my face. Washing my hands, just going to show you guys how to do this. So, hand hygiene, always the most important, because again, the virus is either going to be in those droplets or on your hands, and then if you touch your face, you can introduce it into your nose or to your mouth or into your eyes. So, hands are clean. I'm now going to go grab one of my fresh cloth masks. Again, you can see on this one the way the mask rolls, that this is clearly the inside and that's the outside. I'm trying not to touch my face, so I'm just going to put, this one goes over my ears. And then with my clean hands, I'm just rolling the mask down without touching the inside, because I touched the outside. So now I have the mask on. So now this is trapping my cough droplets on the inside. Again, you're doing this to keep other people safe. In addition to keeping yourself safe, you'll get some minimal filtration this way, but if everyone has masks, it prevents all the cough droplets from spreading. Hands are clean. Mask stays on. I'm not going to, during the time I'm wearing that mask, be touching my face a lot. Again, you don't want to have your unclean hands touching your face. And then when it's time to take the mask off, hand hygiene again. And then I'm going to go from my ears and remove the mask this way. You notice now I'm not touching the inside, which is clean, the outside that's dirty, and actually I can put that down and actually now rewear that mask because I know where my inside is. So as long as you're not touching the inside of that mask, the inside stays clean against your face, the outside, is the part that kind of provides you with the protection. And, cloth masks like this, really simple to wash. a mask with the supervisors. You can use that for a couple days to maybe a week or two if you keep it clean, as long as that inside stays clean and it doesn't get wet or damaged. And obviously the councilman's mask is reusable and washable as well. So a couple different ways to do this, but that's the general way that the masks work, and the right way to put it on and off. Making sure that inside stays clean, making sure your hands are clean, and having that to protect others, so then you're not spreading those droplets when you might not realize that you could be sick.
And it's funny. One person, Amanda, was asking a question about her child that's sensitive, who issues that he can't wear a mask, and that's some of the things we're looking at before we're able to reopen some of these programs. And again, it's through the doctor. There are special places like Camp Anchor that we need to have discussions about protocol that needs to be put in place, as well as all the parks and all the facilities. And people are asking, when are pools going to be reopening? Well, again, a lot of this stems from what the governor and the state are going to limit us. We want to be ready, that we would hope that every pool will be open in a timely fashion. If we can't, we're working on protocols to give people as much as we can. Let it be the pools, let it be the ocean. But again, that's all being done with the insight of not only the department heads, the co-workers, but with the doctor. The doctor is tasked with being on every decision making, because he's the health professional. He should be on it, and I appreciate that. And like I said, we want to get it back to normal. We want to do everything we can, but to avoid, as he said, the second round of a pandemic, we have to take protocol. And people talk about complaining about masks. So I've been forwarded photos from when the Spanish flu took place of baseball games where the baseball players were batting wearing masks, and the pitchers were wearing masks, and all the fans were wearing masks. So this is something that seems so troublesome to some. 100 years ago was almost the normal. And again, we appreciate it. But if somebody does have an issue with a child that can't utilize a mask or has a discomfort, what could be some alternatives, if there are any at all, Doctor?
Yeah, I think a couple things with the mask to the supervisor's question. The first would be, you can see the masks that I'm carrying with me are just kind of gentle cloth masks. They're basically from a company that sells t-shirts that is making masks, and they're using the similar fabrics. So looking out there, depending if you have sensitive skin, you clearly would want to have something that you feel comfortable wearing. If you don't feel comfortable wearing it, you're not going to wear it. So kind of doing a little bit of homework to see what mask options are out there. Basically, any kind of covering that covers the nose and mouth is going to be sufficient as long as you're wearing it regularly. And we had kind of talked about this last time with Anchor. Face shields, that's also something now that people are looking into.
Not something that's not directly on their face.
Right. So my dad was talking about a company that was selling like a ball cap that had like a kind of a face shield built into it. So you have to do a little bit of homework, but again, if you get something that's going to stop the droplets, that could be just a mask in front. It doesn't have to be directly on your face.
Yeah,
that's also another option.
Reading some articles within the last couple days saying that children or adults with sensory issues, you really have to get a little bit creative in protecting them. And I think the discussion you were having with your dad is similar to that. They're making now baseball caps with the shields. Maybe it's a favorite color or a favorite team, and it just makes it a little bit more of the norm.
Yeah, and also remember, guys, the mask, while it can be protective to you, is definitely protective to other people, to decreasing that kind of spread of those droplets. So if you have somebody that for some reason can't tolerate a mask, then you have to be very fastidious that everyone around you is wearing a mask. So don't be afraid to speak up. Make sure they're maintaining that distance and making sure that the people around, if you have a special needs person that themselves can't wear a mask, but everyone around them is wearing a mask, that's going to decrease the risk to that person. Yeah. So that's the most important thing. Yeah, that it's not just you wearing the mask, it's everyone around you wearing the mask. So that you can keep kind of a safety zone. And
I think there was a question. It wasn't coronavirus related, but somebody was asking about a budget. Our budget is available on the Town of Hempstead website. You could navigate through there. It's definitely on there. Last year's budget passed by the town board was actually a 4% Town of Hempstead tax decrease. So that's available on the Town of Hempstead website. If you have any questions, you could give a call at 489-5000. We can guide you through it.
Yeah. Oh, and just real quick to the question about reopening things like the beaches and the pools. I am in communication daily with the Nassau County Health Department. The director and the commissioner have been amazing, and that's been a really good partnership that we've had. And I was just talking to them yesterday, and we are going to be sure that we're in line with whatever recommendations come down from the CDC, from the state, and from the county, and the best updates that we can get health-wise. I'm researching this every day. My colleagues are the same. We talk among ourselves, and then we have great connections in government at the other levels of health. So just understand that it's not in a vacuum, but like the supervisor said, we have to make the right decisions. We want to keep you safe, and it's a balance. We want people to be able to be socially enjoying themselves, but socially distancing and protecting others. And so we just have to, figure that out together.
I just have, I guess, two questions have come in related to sanitation. So the first is special pickup still available? Yes, it is. Call sanitation. Special pickup is still available. There was another question, why is Uniondale seeing garbage pickup at 5:30 a.m.? This is not just specific to Uniondale. We actually, the supervisor and I were speaking to Senior Councilwoman Gooseby earlier today, and she mentioned it. It is not specific to Uniondale. It's been town-wide, and that's just because the schedules are sort of staggered. Some days we have less of a workforce or different people covering different routes. So for the time being, we kind of have to work together. We have to get through this all as one unified force. So if you remember, and if possible, and if you can, let's do our best to get our garbage out the night before. This way, as early as our hardworking CSEA employees can get there, they will. And like I said, it's not specific to any community. We've seen it really all over the town.
And by the way, it's not only all over the town. Actually, I've noticed a couple of villages that the crews are going early. And that was part of the reason we had to merely suspend recycling for the time being, was for the staffing concerns. Generally there was certain procedure of 3 individuals being in a truck. We had to change that procedure where we had to distance them, and there was also concern about employees getting sick, and that's why that was suspended. And for any of the latecomers, we're happy that starting May 4th, the sanitation schedule and recycling is back to full force. In addition to the 1 or 2 people who were looking for a little help with issues in the community, I also remind you, for the building department, the town clerk, the parks department, and the tax office, we create a separate hotline number that it's 516-812-3600. You can dial there and be directed to submit questions or reach somebody in those departments directly. Also, if you go to hempsteadny.gov, we've created a page where you can submit questions directly to those offices. They have a mechanism in place that those questions will go to department personnel, either in the facility or working from home, and they'll respond to those. So, we are still functioning as a government, and yes, and we understand all of you working with us, that we're limited capacity because of the restrictions that have been put on us by the governor, but your essential services are still being provided, such as sanitation, such as water. We do have highway crews out there. Many of you remember the storm we had last week. We have crews out there. But again, it's a two-way street, and we're thankful that all of you have been great, been understanding, and just working with us. Because like I said, we want to get back to a normal, and we're going to gradually get that. But most importantly, it's really about the safety of our coworkers as well as the residents. And that has to be taken into account, because if essential service departments really had not been adjusted according to the doctor's recommendations, we could have had much more serious consequences with our drinking water or our regular garbage pickup. And that's why I said a lot of the decisions are entirely based on what the doctor is recommending in a lot of these procedures.
So 2 things. At first, I see a couple comments from Marcello Luke. He was actually, I was a detective with him in the 7-3 squad. I taught him everything he knows about police work. But he's asking about baseball fields. I know both of his sons are big baseball players. And obviously, we are following all the protocol from the governor. And our parks here in the town of Hempstead are open. Our playgrounds, our tennis courts, our pickleball courts are closed or locked. But the parks are open to utilize, and we just ask that if residents or neighbors utilize the parks, they obviously take into consideration the social distance. They're careful about being near one another. They wear a mask if it's necessary, and they're unable to practice that social distance. But we are doing our best to keep our parks and our beaches open, because we know that people are kind of stuffed in their house and need a place to go and enjoy. So
Yeah.
the parks are open, but you need to practice all that protocol.
And we've talked about this, outside in the fresh air is actually safer than being inside a building, because again, if there's any of those little kind of droplets that are still floating around, they dissipate, they go away when you're in a large open air area. So as long as you're doing exactly what the councilman said, perfectly fine to get out and get stretched. You don't want to be locked up in your house, but just make sure you follow the rules and social distance and wear your mask. And you had another question, Anthony. I'm sorry, I didn't mean to cut you.
Yeah, there was a. Let me see if I can find it. Frank from, I believe, from Franklin Square. He said that yesterday's federal briefing, a doctor was saying that this fall it will be more difficult if the COVID-19 virus comes back with the fall flu season. Aren't we in the flu season now, and why aren't there any regular flu statistics? I think right before this,
right. So
we were
seeing
flu
statistics.
We were having
so we were in a terrible flu season this year. In fact, me and most of my colleagues believe that that coronavirus probably was here for a few weeks at a low level before we got the information from the WHO and from other countries about the spread. And it was a terrible flu season this year. We had there are two strains of the flu this year, influenza A and B. There are two versions of it, and those specific strains were very virulent this year. We had a lot of sick people from the flu. Some people even got flu A and then recovered and got flu B because they're two separate types of flu viruses. So, so the status, we would have been talking about this. This actually was one of the worst flu seasons we've seen since H1N1, and it was affecting a lot of children this year. A lot of children sadly died from the flu this year, more than we typically see. Coronavirus doesn't seem to affect children as much. It seems to be the hypertension and diabetes and overweight seem to be the three biggest risk factors for having complications from coronavirus right now. Obviously, advanced age and immune suppressed are other risk factors, and cardiovascular disease. But just the story got overshadowed because of what happened and the pandemic and how terrible and how many people got sick so fast. But to the question of the flu season, I mean, absolutely, this was a terrible flu season. And I hope as a physician that moving forward, all of the social distancing and mask wearing and hand washing, that we don't forget these lessons, because people die from the flu. Different infection from this, guys. We've talked about how terrible this is and how many people got sick and it overwhelmed our system. But the flu every year is also terrible. So I think that we take these lessons from coronavirus and we apply them to all respiratory diseases, because we don't want anyone getting sick from the flu, from coronavirus, from the regular cold. We don't really want any of that. And then the question as to what's going to happen in the fall, that's the $10 million question. The way you're going to finally see coronavirus kind of disappear is you get enough people that get it and you get herd immunity. But for people to understand, that right now they're looking at the case fatality rate 4 to 5%, somewhere around there. The numbers are still kind of preliminary, but that's a very high case fatality rate. The flu, which people get sick from, has about a 0.5%, sometimes lower. So, I mean, this is 10 times deadlier than that if you're doing that math. So it's important that it's important that we do that. That we understand that you have to take the steps that we're taking, and we don't know what's going to happen when the flu season comes back in the fall. If we have enough therapies for this, which the doctors are working on, we get a vaccine for this. Talking about coronavirus, I mean, that's how we combat the flu, right? We have therapies for the flu, medications for it, and we have a vaccine for it, and that's why we're able to keep the flu under control in for all intents and purposes. So we're going to have to follow that same playbook when it comes to coronavirus. We're researching treatments. Hopefully there's a few, I'm not going to mention names because none of them are definitive yet, but we're going to hopefully have a treatment for this, and then get a vaccine for it. And then when we have that, then probably this will be basically similar to the flu, where we'll see it come and go, but it won't be anything like hopefully what we just saw. None of us want to go through what we just went through.
Right.
So the hope is that we continue to get those things. We're going to have to, we're not going to have to be avoiding each other to the extent we're doing it right now, but we're going to have to keep precautions in place, and we should probably keep those precautions in place from now on for all respiratory diseases, and then that way we know everyone's going to be safe.
As Marcelo kindly referred to as Councilman Rookie, the reality is, we're trying to open up as much as we can. Case in point, last week the governor closed, the ability of people to use the docks, and 5 days later reopened them. But we put into account safeties and protocol with the doctor about signage, distancing, who could go on boats, who could go on the facilities, the family members, the fact that you're not able to tie up boats. Again, we're trying to allow people the outlet they can, but in the proper mechanism. And that's why I said if we can provide the outlet for a resident, let it be a park, let it be a beach, we ask you to work with us and not all get together and not have 20 people looking to have a party or having that football game on the grass. Not right now. And we understand it's frustrating. And we don't want to close places. We want them to be open. But the fact is, so many people are great. So many people are great about, social distancing, wearing the mask, doing the right thing. It's just the few that are not thinking not just about themselves, but about all of us and all of you, and what their actions are potentially going to do, being a little selfish. And we don't want that. And again, I can't reiterate, as things begin to open, the doctor is going to be looking at these state guidelines and helping to make those determinations about if and when the pools. But also know that, here in the town, we are communicating with our sister towns in the North Hempstead as well as Oyster Bay. But I've also been on the phone with the supervisors of Suffolk County, trying to work together to give a cohesive, unilateral service to residents, because the township provides such great services. We provide a lot of the pools throughout Long Island, and all of us want to be on the same page. So we don't need somebody jumping ahead and making a reactionary closing that and someone else not doing it. You want everybody to sort of have the same protocol, so when residents travel from town to location, they'll know wherever I go, this is how they're implementing it here. They're not being that one that's different. They're not being the one that's taking a different task. And again, but for the most part, that's a decision that's based entirely on health. Now, something else that Colette was typing from home, and it was such a valid point, and it sticks to me. I am notoriously, I can't help myself. I have itching and everything, and I've really tried to train myself personally to spray my hands and not touch, my face.
It's hard.
But I'm saying, she kind of brought up a point. What's the significance of trying to maintain, not touch your face? What's the end goal of that? How does that cause the spread of coronavirus, getting so close to, your mouth, your nose, or what it may be?
Okay, so the primary method of spread of this is the cough droplet, and that's what we've been talking about minimizing for the past couple minutes here. But those cough droplets, they when they exit the body, will then sink to the ground. So if there's a table here, and say I sneeze and I don't have my mask on, then there's going to be a certain amount of the virus sitting on the table. We've talked about this previously. Is it safe to get packages? Yes. Can you get this from your groceries? Probably not. Just keep, clean them as you normally should. But if you are not keeping your hands clean and you're in a public place where you have lots of people interacting, there's a chance that there could be coronavirus that is on a surface that you then touch with your hands. So again, remember that this we had talked about this the other day. This is not bloodborne. This is not spread by mosquitoes. This is not spread by other animals typically. Right now, the main spread is human-to-human spread. So if you're wearing your mask and maintaining your 6-foot distance, you're likely not getting those droplets on people. But then if you are doing your precautions and you touch a surface and get the virus on your hands, you have to get that into your body. The only way that can happen is through your nose or through your eyes or through your mouth. It does not absorb across your skin. I could rub coronavirus on my hands right now, and I can stand like this, and it's not going to get inside my body unless I start touching my face, because then you're introducing it into your nasal passage or your eye or your mouth, and then that's how it's going to spread. And it doesn't seem also to be from eating. It's a little unclear on that, but we don't have a really big, so the thought is if you're eating, you're chewing it, it's probably not living on the food and you're swallowing it. But if you're rubbing your mouth or you're rubbing your eyes or nose and it's just kind of sitting there, then the virus makes its way into your respiratory tract, and then that's where the virus replicates, and that's how you get sick. So by doing constant hand washing, again, you do like this, say I have any kind of, and this isn't just viruses, this could be bacteria. I mean, I was a Purell, fan long before this, and I always had this around to keep your hands clean. Once you disinfect your hands...
Most were Corona fans long before.
Yeah.
Not the virus, though.
Yeah. So you disinfect your hands, your hands are clean now, you don't touch your face, the virus has no way of getting into your body. So think of that as kind of your first line of defense, your first and second line of defense. If the virus can't get inside of you, the virus can't make you sick. And so that's why it's important. And it's very hard. I mean, not touching your face. I mean, you saw the last time we were doing this, I was like, oh, I can't touch my face.
No, and it's like my son, he's 8, and one of the things he's constantly always looking to, get a nibble on a nail or buy, and it's something I had to go through with all my kids, that it's, this is the necessity, and I tried to convince them to do something else, hold the bottle or put something else in their hand to stop that urge of bringing their hands near their face, because they're little and they don't understand it as well as maybe an adult would.
Of course, and then the other thing, guys, is a barrier. So tissues, if you have carry those little packets of pocket tissues or a tissue box, if you have an itch on your face or you happen to blow your nose, as long as there's a barrier, you wash your hands and then there's a barrier with that tissue, then you're also keeping yourself safe that way as well. So that's also important. If you keep that around. If you feel like you're constantly itchy, even with allergies and stuff, as long as you have your hands clean or using a tissue, you're not going to spread it that way either. So that's another good way to do it.
So every Friday at 3 o'clock, our friends at Nassau Community College have a show called This Week's Long Island News. It's on at 3 o'clock. So today, 3 o'clock, you could tune in after this, 90.3 FM. They have a question. Is there a daily accounting of Nassau, Town of Hempstead nursing homes, extended care, assisted living, group homes, etc., and their PPE needs, like hospitals?
Yes.
I could only say, at least, I'm sure the doctor will go into it a little further, I know that we have done our part at our Emergency Operations Center to assist any of those facilities here in the town of Hempstead. Supervisor Clavin made it clear from Jump Street that if we could assist them or any of the fire departments or EMS agencies with any sort of PPE, as long as we had it, we were willing to help.
Yeah. So the answer to your question is yes. The Nassau County Department of Health is keeping track of that, and they are checking in with those facilities. And I can tell you that the Andy Simone, the director, called me the other day and indicated that there was a nursing home that had a critical need for personal protective gear, and we were actually able to help out the health department and that skilled nursing facility by giving them some Tyvek suits. Our town workforce has been amazing. When we put the initial word out at the beginning of this that our EMS providers who have been on the front lines, and I cannot be prouder of them, when we said our EMS providers need to be safe, our workers went into our warehouses and found us Tyvek suits and eye protection, and the animal shelter had N95 masks that they use for some of the stuff with the animals, and they gave us some of them so we'd have them. So we have supplies for our people because of the tenacity and the creativeness of our workforce that knows how important it is to take care of us. And I know we've talked about this. We've worked extremely hard to keep the workforce safe, and that's been a wonderful partnership. So when the health department reached out to us the other day and asked if we could help, we immediately answered the call, and we were able to help out that skilled nursing facility. So that just shows how good our partnership with the health department is, that we're working with each other and helping each other. We don't have a huge supply of this where we could just be giving it out, right. But if there's a critical need, we want to make sure everybody in the town of Hempstead safe. We recognize that importance, and like I said, our constant communication with our county partners has made that just a really good relationship, and that allow us to serve our community better. So,
yeah, Susan, I saw your point about you thought all construction was supposed to stop. Some construction is allowed to continue based on the necessity and the emergency. So there's some cases where it is allowed to, but if you do have a question about it, I think you said you lived in the village. You call the village. Call the Nassau County Fire Marshal, and for all non-village residents, if you see something, say construction taking place, and you have a question and want to make sure, if something's being done that isn't appropriate, please dial 516-812-3600, and you can be redirected to the building department or submit your question via the webpage we've created at hempsteadnewyork.gov, where questions will go right to the town building department. In your case, Susan, I think it indicated you lived in the village of Hempstead, so I would reach out to village officials. And again, everybody's doing their due diligence. If you can call the Nassau County Fire Marshal as well, and they can come and take a look at it and close it down if it needs be.
There's a question here from Amanda, who's asking, what is being done to educate our youngest residents on the spread of prevention? We love your flyers, but kid-friendly version would be very nice. Thank you. So that's a great idea. I think maybe going forward, we could sit down with Dr. Dave and craft a kid-friendly informational mailer to get out to our youngest town of Hempstead residents. And obviously, this isn't going to be a short-term, we're not going to fix all this short-term. This is going to be, we're in this for the long haul. So as we all hope, in September, we're back to normal and kids are in school. I know that I speak for everyone on the town board, whether it's Senior Councilwoman Gooseby or Councilman Blakeman, Councilman Dunn, Councilman Muscarello, Councilman Carini, and obviously with in conjunction with the supervisor. We are happy to work with our local schools and providing the information just as we do with vaping and opioids and our Narcan training. We're happy to work with our schools and any of our kid-friendly organizations in order to provide the information that they need to keep healthy and safe after Corona.
Absolutely, and our EMS agency, again, I'm very proud of them as always, has taken the lead with the guidance of the councilman and the supervisor. We've been doing a lot of public health initiatives, and along that, our EMTs are trained by me, and we have educational, educational seminars that we do. So if there's a need at your location and you would like either the doctor or one of our EMS providers to come out and with the education and the knowledge, we can certainly put something together that we have a flyer. But that's something we were doing, with like the councilman was saying, with Narcan, with vaping, with CPR and first aid. We've been doing all sorts of stop the bleed. We've been doing all sorts of public health initiatives to keep our community safe. So this would just be another one we could add on there, that if you identify a need, we'd be happy to send someone out to address that need. We do that on a regular basis. So I mean that's how we're here to help you.
Which is rare for a township.
Yeah. I mean that's why it's your EMS agency is really unique. There's a very active physician and very active medical providers that want to help with the public health, and and moving forward, I think that we're going to show continue to be the lead in making sure the government handles public health initiatives and problems. And I mean, from the beginning, that's what we've been doing. And I mean, it's shown in spades that we're helping people and making people healthier and saving lives. So I mean, it's important. So it just continues with what we're doing.
And also, it's from great ideas like Manda. That was just a great question to ask. That you say, geez, what programs can we put in effect? For the youth who use the town facilities, as well as maybe we could do an educational program in communities in conjunction with school districts or other youth groups. And that's why, when you have a great idea, if you could forward it to us, send us the email. A great idea sitting in your head all alone, is that a great idea to you? If you could pass that on and we could utilize that, we will. One of the things that I know the councilman's always been a lead on has always been the adoption program right here at the town shelter. And we've had a number of people foster animals, and we say to people, if during this time, if you want to, utilize those services of our shelter and take home as he likes to put it, a furry friend, being it's Furry Friday, take advantage of that. And if you have other ideas of things you can implement, please email your town board member, email me, submit it to any of the departments. They will be looked at, and if we can incorporate it, it definitely will be.
Yeah, I mean, just to follow up on Supervisor Clavin's suggestion, I mean, many think that a lot of our services, are closed, but the animal shelter is open, and like he said, you can call ahead, make an appointment, and they will actually bring the animals out to you. While we're all trying to get out in the open air and walk and enjoy the fresh air, it's nice to do it with a four-legged friend. So definitely keep that in mind.
Cool. So with that, why don't we, Doc, I'll have you give a couple of closing thoughts here.
Yeah. No, this is good. We've all been working together. We've certainly shown that the steps we're taking are working. We don't want to let up now. We want to continue as a team to work together to stop the spread. Again, just to kind of piggyback off the supervisor, if you have needs where we can help with your health and ways to make it better, or you have ideas that we could go out and educate our community and educate our friends and colleagues, that we are very eager about that, and we get the best ideas from other people sometimes. So just understand that we are actively daily. You may not see what happens in the background, but daily we are. Even before the pandemic, we were looking out for the health of our citizens and our friends and families. So just continue to communicate with us. Continue doing what you're doing. Don't let up on the fight that we're fighting, because it's showing a really good effect right now, and I can, have some good news that it's getting better. It's still a long haul. It's not over. I mean, realistically, we're probably going to be dealing with this for, maybe another year or two. Hopefully not anywhere near what we just saw, but that's why we have to work together. We'll continue to communicate with you. Understand that, we'll continue, from the medical perspective to talk to our partners, and we'll all make sure that we're on the same page and that we have the right answers, or the best answers we do at the time, and just be patient and understanding that we want you to be healthy, and we want to do what's right for you guys. So that's what we're going to keep doing.
Johnson?
Just, this weekend, I'm just looking at the weather, seems like sort of a 50-50 weekend. Tomorrow's supposed to be beautiful, Sunday, a little bit of rain. For those of you that are out there enjoying our town of Hempstead parks, our county parks, the state parks, just be careful. Keep that social distance. Remember that we have to have some personal responsibility, but enjoy the day, and realize that all the steps that we are taking are really preparing for our future, because this isn't going to go away quickly, but we can do our best to make sure that it ends as soon as possible.
Definitely.
So just have a great weekend, stay healthy, and God bless.
And thank all of you for taking the time to watch and participate. For any of you latecomers, I just want to give another shout out to some of the initiatives that have taken place. Back in March, the Receiver of Taxes, Jeannie Driscoll, the town board members, and I joined asking the governor to extend the deadline to pay your second half taxes. That has been granted. Second half taxes are now due without penalty till June 1st. They can be paid when I believe is starting the 22nd at the main office and the drive-through there, as well as the Receiver of Taxes. And I've created 3 different satellite locations for you to pay taxes, from being in the 5 towns down in Seaford and the last in West Hempstead, where you can pull right up, hand in your check, and get your receipt. Go to the town website to take a look at further details for that. In addition, for all of our friends, recycling and full collection is going to be back up in force starting May the 4th, Monday. Regular schedule. Again, we thank all of you for the understanding of why this needed to be done at the advice of our doctor for staffing. We love recycling, and it is going to be back up, and we're delighted. And as time rolls on, we hope to bring back the other programs that have had to be suspended temporarily. Our STOP program, our recycling, of drop off, our dropping off old electronics. We hope to bring those back up, but again, it will be done with advice through the professional in these cases, with proper protocols being put in place. And again, that comes to all the parks, all the playgrounds. When we are allowed to reopen, and depending on the circumstances and the guidelines that are going to be set forth by the governor and the health professionals about what it can be, we will implement that. Look, we want to be 100% open. We want everybody to enjoy the facilities, and we are going to do the best of our ability to put into place to have things open, but with the requirements that are being set forth by the state and by our health professionals. So with that, I will...
Supervisor,
Yeah.
just one more initiative that we may have forgotten. Just a reminder to everyone, our great town clerk, Kate Murray, has put up our marriage license information on our website. You could download the application, and if you're interested in making quarantine a little bit more interesting, and you need to get married, our great town clerk is still accepting those applications, producing the marriage licenses, and we are conducting marriages. I know she did one today via Zoom.
Yep.
I am, available to handle any marriages as long as we're free and we're able to. And that's it.
So with that, be advised, we'll post up our next conference. As things change, we will keep people informed, especially through social media, emails, to keep people advised of the changes, as it seems to be every single day. Again, I want to thank the councilman, the entire town board, for all of us, taking the time, communicating every day. Dr. Dave being here on a daily basis, after emergency rooms at night, being here during the day, and giving the great advice that's helped to stop the spread of this pandemic. And lastly, to all of you, this is a two-way street. All of you have been so great about understanding some of the changes and been patient. And like I said, as things can be reopened, we're going to do it in accordance with the law, in accordance to our health professionals, and get back to normal. But continue to, follow the advice, wear the mask, wash the hands, spray the hands, don't touch the face, and maintain the social distancing so we can open up sooner and remain healthy. So thank you all again.
Stay safe, everybody.
Stay safe.